My name is Ezra Steinberg. I'm one of the surgeons here at Maine Veterinary Medical Center, and today we're going to be talking about post-operative care for tibial plateau leveling osteotomy, often called TPLO. And I got my buddy here, Buck, to help me go through this. TPLO is the most common procedure that we perform here, which is a treatment for anterior cruciate ligament, or also known as cranial cruciate ligament injury in dogs. The post-operative period is pretty frustrating for most family members, and it's one of the hardest parts of the entire procedure that you guys have to go through, both the patient as well as the owners that are taking care of them. Recognizing that not all post-operative care is going to be the same from animal to animal, we do have a very standard approach between all three surgeons here at MVMC. The first 2 weeks that the patient goes home, they are wearing this e-collar at all times. There are many different sizes and shapes of e-collars, but these hard plastic ones are really the only ones that are tried and true, and we don't want to take chances with an incision. The leg is not covered by a bandage, a splint, or a cast, and given the opportunity, dogs like Buck here would love to lick at that incision and get it infected. When they go home from the hospital, they have usually antibiotics, pain medications, sedatives, and an anti-inflammatory. Not all dogs are going to have the same exact medications, but depending on your patient's health status, we will help come up with a plan for all meds. The activity restriction, that's probably the hardest part, and we recognize that. And all we can ask you is to do your best. When a dog goes home from TPLO surgery, they're not going to want to lay on the couch for 2 months while they heal. They're going to want to get up and pick up exactly where they left off. So we can't let them make the rules, we have to enforce them, and we know it's not easy. In the first 2 weeks, when they are home from the hospital, prior to the incision healing, they are going in and out to pee and poop, and that's it. They're not going on any walks, they're not going on any joy rides, they just need to go outside, do their business, and come back inside. When they go out, they should be on a leash at all times. We don't want any running, any jumping, any playing. We want to decrease the amount of stairs that they use, so we recognize that some people have to use stairs to get in and out of the house, but for the most part, try to limit it. At the end of the 2 weeks, you're going to send us a picture of the incision, or we're going to recheck the patient in person, and we want to make sure that that incision has healed before taking this cone off. Sometimes it's covered by a scab, and we're going to want to give them a little bit more time with the e-collar on. But we'll send you home with an email address to send us pictures to, which you can do along the whole course. If you have any concerns at all, you can send us pictures. What we normally see is in the first couple days after surgery, there's a little bit worsening of redness and bruising, maybe a little bit more swelling, and then it should start to improve over the first 2 weeks. We also will sometimes see some swelling down here by the ankle. The surgery site is up here by the knee, but we'll sometimes see some swelling near the ankle a couple days after surgery, which is totally normal. It's just edema, so fluid that's built up underneath the skin, and it will subside, it will redistribute over the next several days. At the end of the 2 weeks, once we give you clearance to take the cone off of the head, at the end of the 2 weeks, once we take the cone off, because the incision is healed, we can start to let them do a little bit more. So what we normally do at about 2 weeks post-op, we allow 5-minute walks 3 times a day. Very brief, in and out, just to explore. No running, no jumping, no playing. Try not to take them out with other dogs. Try not to take them out during busy times when your neighbor's dogs are in the yard, because we want to start off slow. At the end of the 3rd week, we're going to do 10-minute walks 3 times a day. And then at the end of that week, we're going to go 15-minute walks. So we're going up by 5 minutes every week. At the end of the 8-week period, they should be able to go on about a 30-minute walk on a leash at all times with an improving limp. They'll still be limping a little bit at the end of 8 weeks, but we should see an improvement each day. If there are any setbacks, if they jump off the couch, which they should not be on, if they play with another dog, which should not happen, we totally understand. If they come up a little bit lame after, we say give them a couple hours, a half a day, and they should improve the next day. It's just if they overdo it, they can have a minor setback. If there's anything scary that happens, if they get out of the house and run around, if they jump off of the deck, we probably want to recheck them in person, but obviously give us a call.